So when I tell somebody I'm a genetic counselor, I get tons of questions. Do I help pick gender of babies? Do I help design human beings? No. I like to describe my job as a mix between genetics education and helping people understand what's going on with them genetically, if they have a certain condition or if there's something going on in the family, trying to help them understand that. And then also the counseling piece, helping a family deal with whatever condition's going on, manage it, tell family members, get resources. So kind of both that education and counseling pieces. I think our first genetic counselors were probably in the mid to late 80s, and there are only about 32 programs to train genetic counselors in the country, and it's numbers that are growing. We are up to about 4,000 genetic counselors now in the country, but the need is growing as we learn more about genetics, learn more about conditions that we previously weren't aware of. So a genetic test is a blood test. We have DNA in our blood cells, and we send that blood off to a lab that can isolate the DNA and then check to see is there any problems, or I like to call them spelling errors, within that gene that we're curious about. I work in adult genetics, so I see a lot of family histories of breast cancer, colon cancer, examples being Lynch syndrome or the BRCA gene. We see a variety of different connective tissue disorders and heart conditions like Marfan syndrome. Genetic counseling helps a family first understand their family history. We take a really thorough, we call it a pedigree, it's kind of like a family tree to help understand what do different family members have, how old did family members live, what types of conditions are running in the family. So that's the first place I start with patients I meet with, is just gathering that information and encouraging them to reach out to their families to gather that information. And then helping interpret that and explaining what it means to them, what the risks are to them, what the recurrence risks are, where do we go from here, how do we help manage that? And then is there any sort of testing that we should do to help confirm that genetically? What would you do if you did find out that you had this hereditary cancer syndrome? Would you think about having a prophylactic mastectomy like Angelina Jolie did? Would you think about removing your ovaries? Or some people opt for just increased surveillance. And so really figuring out a plan that feels right to the patient is important to talk about it up front. I think one of the misconceptions about genetic counseling is it's all about the genetic testing, that people come in for a blood draw, they come in for a test, and we do a lot more than that. Not every patient that meets with me needs a genetic test or is appropriate candidate for a genetic test. So really just basing our conversation off of the family history and what's going on, and helping provide either reassurance or direction and where to go with what's going on in the family.